Welcome to At the Table with CAHSAH. I'm Mark Wilson. Support for today's episode comes from Healthcare Synergy. Technology is important, but having the right people behind it matters too. Healthcare Synergy, helping home health and hospice agencies operate at peak performance. Learn more at healthcaresynergy.com. Okay, we're going to get into it today. Artificial intelligence, AI. Everybody's talking about it. And depending on who you talk to, it's either going to transform healthcare and make our lives easier, save us enormous amounts of time, solve workforce problems, and make us much more efficient, or it's going to replace everybody, make terrible decisions, and kill us all. I suspect that the truth is somewhere in between there. But here's what we do know. AI isn't coming to home-based care. It is here right now. So today I want to talk about not futuristic concepts or anything like that. I want to talk about what's actually happening, what's going on for people who are running their agencies, what can AI do, where can it save time and money, what are the risks, and where do we have to make sure that our human judgment stays firmly in control. So joining me at the table today is Scotty Strong from Strong Consulting Services. Been around working with home health and hospice since 1993. His work focuses on billing, administrative operations, Medicare reviews, compliance strategy, documentation, and agency workflow improvement. Scotty's represented clients in well over 1,000 administrative law judge hearings and has assisted with approximately 1,500 to 2,000 ADR reviews. He's got a very impressive resume. Scotty, welcome to the table, my friend. Good to meet you.
Thank you, Mark. Thanks for having me.
So let's get right into it. Where are we right now with AI and home-based care? I mean, there's a lot of hype out there, and I made a lot of notes at the CAHSAH conference here last month. But, I mean, you're working with it extensively. Where are we right now?
Well, let me start with an analogy. I always treat or look at AI as a tool, right? That tool is like a hammer. And if you have a carpenter, he's great at it. He's driving that nail. It's going straight in. One whack, he's done. If you have a person that doesn't know how to swing that hammer, they're bending the nails and ruining the project. So essentially, you have AI out there, and you have to be extremely careful because are you allowing AI to make determinations for you? Or are you using AI for the tedious tasks that you have people typically miss information? AI is excellent at absorbing a lot of data.
Okay. You know, what's interesting to me is 3 years ago when I'd go to the CAHSAH conference or any other conference around the country, the AI guys, the tech nerds were sort of hanging around. And, you could be sitting in a bar 3 years ago and they'd approach you and start talking to you and they would pick your brain. And you knew exactly who they were. They were tech nerds who were building something.
Yes.
And I don't know, 2 years ago, they started to come around with things that they were developing.
Mm-hmm.
Now they've developed, they're here, and it's kind of crazy to see how it's come along in the last 3 years. I mean, we're full on and we aren't done yet.
No, we're nowhere near done. And the reality is that everyone should be utilizing AI as an assistive tool. My concern is more and more of what I'm hearing is AI is, like you said, going to solve every problem known to mankind. And so what inherently happens, and I don't think a lot of people are aware, that AI drifts because it doesn't have the rooted foundation of whatever it is that you're asking it to give you answers on. So if your model that you're using says, let me package this information up, send it up to AI, get a result, and actually operate based on that result, you're going to be in a lot of trouble. Because in the end, every agency has demonstrated to Medicare that they understand how to operate in this environment. The moment you introduce AI, it's just like kids in school, right? They started using AI to write their papers. Well, the first tool that they created was something to determine whether AI did it or you. Imagine Medicare trying to put the hammer on folks, and they create their AI tool that says how much of that was AI generated versus a clinician.
Well, and that's where, to me, there's going to be some judgment calls at some point, because I can, as human beings, This is my opinion,
Uh-huh.
Scotty. I think that when we start using something, we become dependent on it, and
Yes,
more and more and more and more dependent on it, and we stop. Um, what's the right word? Not being careful, but we allow it to do more and more of our work. At some point, though, we're talking about human beings and healthcare. A human has to sign off on it somewhere.
absolutely. Absolutely. And where you're going to run into a problem is when someone allows AI, for instance, to write their note, and because of their work volume or just the fact that they're pressured to deliver a billable document, they just accept whatever AI says. And so then, yes, that person put their signature to it, but you know what their answer is going to be? AI said so. That's what they're going to say.
You know, it's interesting. I couldn't tell you where I heard this story, but I know I heard. I know I didn't dream it.
Mhm.
Someone was talking about the assistive hearing or the listening,
Adaptive listening.
adaptive listening. Thank you.
Ambient listening.
Is that what it's called? Okay,
Ambient listening, yes.
ambient listening. So, nurse is in the room with a patient, and there's family around, and they're going through medications. And someone walked in the room and mentioned their dog's medication, just having a conversation. That medication for the dog ended up in the
Yes.
patient notes.
Yes.
Hello?
Can you imagine?
Can you imagine?
And what's worse is because they relied on AI to do the right thing, no one really QA'd it to extract it from the record. See, it's one thing for ambient to pick it up. There should have been another safeguard that says, hey, are the medications listed in the medication profile to recognize that this medication doesn't belong? And since we got AI, shouldn't it identify that medication as a animal medication? But I'll tell you what'll happen. Take ivermectin. People were using it. It's primarily an animal medication. And so now AI is going to say, but we've found some acceptable uses and it's going to let it pass through. This is the danger of using AI to make determinations.
And just so we put it out there, Scotty, you are an advocate of AI. You're not. You're
No, I use it 12 to 14 hours a day. Oh, I
yeah.
could.
You've embraced it.
Yeah, I'm fully embracing it because it makes me way more efficient.
But as a healthcare tool, you're embracing it for
100%.
agencies around, and we'll get into why, and I'll probably throw some things at you that I'll make you defend. But
Absolutely. Yeah, no, I'm a 100% advocate because it does some things that I think empowers the people that are required to do repetitive tasks and in a limited amount of time, and they're going to naturally miss some things simply because it's the sheer volume of paperwork. We're talking 200, 300, 400 pages.
yeah, yeah.
You're asking for a whole lot to be accomplished.
And just so the people out there listening to this, the agencies listening to this, understand where they are. I want them to be able to judge themselves in terms of where they are and their thinking right now. Are you finding with the organizations that you work with, are most actively using it? Are they experimenting with it? Or are they still just trying to figure it out?
Right now, they are we're just trying to figure it out. How does it fit into our operations and is it safe?
Okay. I also too, and I always think about the smaller agencies out there. Do you think the smaller independent providers are maybe at risk of falling behind the larger organizations, or can they keep up just as easily?
In all honesty, they should be able to keep up just as easily as long as they recognize the tool is valuable. The problem is the smaller agencies are probably going to be slower to adopt that this is a valuable tool. Then they're going to get on the bandwagon when someone tells them that they're behind. And by then, they're just going to use whatever somebody recommended and not have done any research into what's the best practices.
Right. Okay. Something else I'm curious about, Scotty. A provider out there may be saying we're not using AI, but they are, and they don't know it. Their EMR or their scheduling software or whatever. I mean, could they already be using AI without even realizing it?
Yes, they could. Because most of the AI right now are giving you bits and little pieces. Okay, it's embedded in such a way that you don't really understand that it's doing it because you may get a suggestion or a pop up that says, "Hey, you should do this or do that," and you're not aware that that's actually AI because you're not interacting with AI like you do in your regular life, which is going to some type of AI product and asking it a recipe.
Right. Okay. Yeah. All right. Let's get real practical here, Scotty. Home health and hospice agencies have to deal with, as you know, just an enormous amount of administrative work. The documentation and the scheduling. I'd like to, if you don't mind, kind of go down specific areas and ask you where AI is making a big difference and what it can make a big difference. And I'd like to start with documentation. Is it going to improve the quality of documentation, do you think?
That's a good one. And I'll tell you why it's a good one. It all depends on what the AI is basing its suggestions on. Okay. If it is simply reaching out into the netherworld to find answers based on whatever someone has already asked, which has now become a pool of possible answers, no, I don't believe it's helpful. If it is looking at agencies' policies, Medicare rules, then saying, based on what you've done, this is what maybe you should look at, and essentially turn into a clinical deficiency tool. Yes. But if AI makes any type of determination, I have a huge problem.
But okay, will it overall though reduce the burden on clinicians?
It may increase because right now, and let me give you an
Wait a
example.
minute, what?
Yeah. Okay. So look at it this way. You have a nurse, she goes out and she does her visit.
Yeah.
And she normally turns in that paper. And because the people that normally look at that paper don't really read it, they don't even realize the gaps and the missing items. Once you ask AI to look at it, it's going to go field by field to say, oh, you didn't answer box 10, 12, 14, and 18.
Oh.
Okay.
Okay.
And so AI is going to be a much more discerning eye than what is currently happening.
Got it. That makes sense now. Okay.
So
it's going to point out the stuff you missed, basically, is
yeah,
what you're saying.
and the stuff that you did answer, maybe it doesn't even match the patient.
Yeah. That's like you cleaning your room when you're a kid and you're real proud of it. Your mom comes in and goes, "No, you didn't get that,
You threw everything under the bed or in the closet, right? So I'll give you another perfect example. You're sitting there, you're doing your documentation, and one of the vitals is out of whack. Patient's blood pressure is 180 over 100. And you just documented it. But did you write the physician order? Did you make a notification? Now, a good AI tool would have the parameters that you're looking for that require you to notify the physician and generate the order. Why? Because it knows where you were out of range and it knows what it needs to notify the physician and it generates it. That's a time saver.
Right. Okay.
That's where and it's a compliance saver because usually that gets missed.
Sure. Okay, let's move on to coding and revenue cycle management. I'm assuming that, and I might be assuming wrong, that the AI can also identify coding opportunities and potential errors there too, just like in the
100%. So now where you also have to be careful is, does AI just suggest the most highest paying coding sequence? Or does AI look at the record and make a suggestion to you based on things you may have overlooked, and so you didn't include that code? So again, time saving versus true functionality.
right.
AI will give you 200 codes because it says that all of these could be applicable.
Okay. Yeah.
So now you need a human to say out of those 200, which they wouldn't have thought of before,
right,
the most applicable.
I could hear people out there right now though going, okay, but will it reduce denials? Hello?
Okay. It should, because it knows exactly everything that you have to have in order to bill a claim. So if the AI model is correct, it's looking at everything and saying, you got to have all of this. Then it's reading everything and say, you either do or you don't.
Right.
Okay. So yes, and it can do that in a relatively short period of time. So now you get a time savings. That means you should be able to bill more. You should be able to collect more. and you should be able to defend what you got paid for.
Right. Okay. All right.
Again, it's very doable, very doable.
Let's move on to scheduling. Scheduling efficiency. AI. Tell me about it.
One of the first things I could see AI helping with is a couple things. Let me say, location of caregiver, location of patients, matching the best caregiver for those patients. How many caregivers are frequently making all their visits versus rescheduling? Okay. Now I can start to rank my caregivers to saying, you know what? I can count on her. And so she lives in this area. So patient matching. You can also throw in routing. What's the best route for my day? So I can reduce time traveling and see more patients. Those kind of things AI can help with.
What about, and this is something that, this is crystal ball kind of stuff, stuff that we've always looked for, predictive tools, in terms of just staffing. I mean, can it do that for us? Can it say, look, seeing some weakness here in 3 days down the road, you're going to need some help.
Okay. Realistically, the only way that can happen is after, say, maybe a year or so of collecting data.
Okay.
So that you can actually analyze the patients, the outcomes, and all of that to now start to predict 60-something-year-old male with yada, yada, yada condition should be getting X number of visits, and the outcomes have been positive at this number of visits versus that number of visits. But then if you don't factor in their psychosocial situation, because if I have a person that has a great family support versus a person that has zero family support, a person that lives in a relatively calm place versus a relatively violent place, there's a lot of factors that could give variables as to any individual patient's outcome.
You know what you're just reminding me of, though, is the fact that sometimes I think it's just a simple transaction. Okay, now we're going to start using AI. And there it is. You unpack it and whatever you got to do to install it, boom, it's AI is self-learning. It learns as it goes. So I'm using it. I start using it today. A year down the road, it's going to have much more data. It's going to understand much more about my business, and it's going to accommodate that.
Well, but then is it still being regulated by an external source? See, that is the fear. Just recently, did we hear that like all the AI models went rogue?
Yes.
They hacked other software.
Yes.
So they gotta look, you and I are both of the Terminator age. The age of the machines. Yes. Skynet just took over. and it's sounding eerily almost realistic nowadays.
Yeah. No, Scotty, I think that's what scares people.
And honestly, I'm not afraid of AI. I love it. I actually love it. I think it's a great, 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 great tool, but it has to operate within a regulatory box, and the individual provider must control the regulatory box because ultimately they're responsible.
Right. Yeah. Well, I mean, again, a nurse is a nurse, and that nurse, once she or he signs off on a note, it's still them.
Yes, that's right. And extrapolate up. It's the agency because they're the ones that build Medicare or whomever. And so ultimately the ownership or the management team will be held accountable for whatever took place up until that money was received.
So one more here on my list of things, compliance. Can AI identify potential compliance problems before the auditor does?
Actually, that is, I think, its strongest capability. And again, is there a regulatory body, though, attached to it? So that regulatory body says what is the compliance measures that we're looking at. And honestly, it has to be the agency's policies and procedures because those were designed to be in line with Title 22 from the states, Medicare conditions of participation. All of the rules were created under the guidance of the agency's policies and procedures.
Right.
If the software is not taking that into account, it's actually can't be compliant.
But either way, AI could be an important part of the audit. Huge. The audit preparedness.
100%. It should be integrated in because it can review all the charts. Whereas normally when you have survey prep, you're pulling a percentage like the surveyors do. And so you're saying, okay, I want 10% of my charts reviewed. No, AI could do 100%, and they could do it all the time.
See, I'm not laughing at it. It's just like you said, it's amazing that we're living in these days.
Oh my
that
God.
I mean, it really is. And for me, I know, like a lot of people, I embrace it too, like you do, because I think it's going to create enormous efficiencies just in business in general. I mean, regardless of whether it's home-based care or not, or any other business.
Yes.
But I don't think we quite know yet where the guardrails are, and it's going to be interesting to see going forward how that looks and how it
I don't think
feels.
there are guardrails right now.
Well, that's what I'm saying. Yeah,
Yeah, there aren't any. There aren't any.
It's the wild, wild west.
100%. And
And
I don't see anybody trying to put guardrails up. And so ultimately, the providers must protect themselves. They have to know the guardrails, and they have to know I can't utilize anything that's going to go outside my guardrails as a provider.
right, okay. Before we go any further, Scotty, let me stop down for just a moment to acknowledge support for this podcast comes from Healthcare Synergy. Running a home health or hospice agency today isn't getting any simpler. I think we know that. That's why providers turn to Healthcare Synergy. For more than 30 years, Healthcare Synergy has helped agencies operate more efficiently with powerful EMR technology, clinical services, billing and revenue recovery, and the expertise to help you navigate an increasingly complex healthcare environment. Technology is important, but having the right people behind it matters too. Boy, does it. Healthcare Synergy, helping home health and hospice agencies operate at peak performance. You can learn more about them at healthcaresynergy.com. That's healthcaresynergy.com. Scotty, this is a fascinating conversation. You know what? I'm afraid we're going to run out of time. So I think we'll probably end up doing a part 2 because you're a fascinating guy to talk to. And I think the agencies out there, at the CAHSAH conference here in, when was it? Late June?
April.
No, June. Late
Was
June.
it June?
You went to a different conference.
Oh, okay. I was going to say, not only that, time is flying so fast.
I know, right?
Man, it seems like Monday becomes Friday in a blink.
But everybody's sort of talking about AI, and when they're not talking about it openly, they're in the corner going, "Oh, you guys are whispering about it. What are we going to do?" So I think it's just a fascinating thing to talk about. Let me ask you for the moment here about, that one of the biggest challenges in home-based care right now is workforce. We're asking clinicians to spend time caring for patients, but we're also asking them to spend an enormous amount of time documenting that care. I guess my question is AI going to give, and we won't hold you to this, Scotty, it's not like you're in charge of AI, but could AI actually give clinicians more time with patients?
Yes. I'm of a firm belief systems will be available to actually help them document by voice, spend less time actually handwriting anything, and help with QAing the work as they're doing it to reduce errors and duplication of work. So yes, I am a firm belief that there will be systems on the horizon, in all honesty, in the next 3 to 6 months that should speed up the entire documentation process, which will in turn speed up the revenue collection process.
And I would think training is going to be so important because, again, where does AI assistance become too much AI involvement?
Yes.
And, where is that line?
Well, the line is you shouldn't know that AI exists in the product. As a matter of fact, I tell everybody, when we get to mobile documentation, it better be as simple as using your iPhone. I don't think anybody got a manual. Right? And we switch from phone to phone, and we somehow, some way manage to utilize it as though nothing has changed.
Yeah, absolutely. I mean, there's a big distinction. There's using AI to help a nurse document what's happening, and I don't know. There's allowing AI to influence clinical decisions, and that's where I get a little bit.
And I'm with you. It should not
uncomfortable.
influence. It should not influence clinical decisions because at this stage, as we initially discussed, there's not enough collected data to actually intelligently make suggestions about care. And if AI is making any suggestion about care, and it's not the actual clinicians that came in contact with the patients and the directors and what have you, they're really pushing the envelope of too fast, too soon.
Yeah, there's got to be a line drawn somewhere, right? I mean, we're going to have to, and it sounds to me what I'm taking away from this conversation with you, the expert, is um, that we don't know yet. We're going to kind of find out together.
Correct.
As
And
we,
what the government will allow us. See, that's the thing that at some point AI is going to make a mistake and somebody's going to jump up and down, and then the whole thing will come crashing into a regulatory model. That's what you want to avoid from the beginning.
yeah, but yet that's like saying, okay, we wait for plane crashes to happen so we know how to improve air safety. You know what I mean?
Well, you still have air traffic controllers.
Well, I know, right. Right now, but you
Yeah.
know what? The planes don't need pilots anymore.
Well, that's true. That's true.
You
And,
can,
and they're just sitting there. Just like
and
the
if you
trucks
think
on
I'm
the
getting
road.
on, you think I'm getting on, I won't get in a car that's not got a driver. You know, they're running around up in I don't know if they have any in LA where you are.
Yeah,
but
they
in
have the
San Francisco.
Waymos and
Oh, yeah, I'm not getting into one of those, and I'm
I've
not
done
getting on a plane without a pilot.
I've actually done the Waymo, and it was a weird experience.
And by the way, when I get old and I need some care, and I'm old school, I want a nurse. I don't want
Yeah.
a robot.
That's right. That's right. I agree. I much prefer that. So you're the conversation is right. The conversation is early. And so it's a great time to have the conversation. And like I said, for me, if anybody got anything from this conversation, as far as I'm concerned, is just understand where it should fit in your ecosystem. And as far as I'm concerned, don't let it make decisions for you.
Yeah, good advice, Scotty. Listen, we got to do a part 2. Would you mind doing a part 2?
Absolutely not.
Okay, because I have a lot more that I want to discuss with you. But for today, we got to wrap it up. Scotty, thank you so much for joining us. Scotty Strong. Scotty, right? Not Scott. Do people call you Scott or Scotty?
Absolutely. You know, they call me Scott, but
You're Scotty. You're
Yeah.
Scotty, though.
I'm Scotty, but I'd say it's a 50-50 world. Most women call me Scotty and most men call me Scott.
Oh, really? All right. Well, Scott. He's the founder of Strong Consulting Group Services and knows an awful lot about home-based care. He's been around the industry since 1993 and is an expert in all the things that we're talking about today, AI. I think the important takeaway from this conversation for me is that AI doesn't have to mean replacing people who provide care. I mean, we're not there yet. And I shouldn't say this maybe. I hope it never happens. I think healthcare is still it's still a people business. Can we use AI to remove some of the things that keep people from providing care? Less time chasing paperwork, less time searching through records. That's the big stuff for me. I mean, if you can cut that stuff down, time down on that, boom, let's do it. Less time dealing with repetitive administrative work is always going to be a good thing. But the technology is moving quickly, and healthcare organizations are going to have to balance innovation with privacy and compliance and accuracy. And what I'm getting from this conversation is just good old-fashioned human judgment.
Correct.
So again, Scott Strong from Strong Consulting Services, thanks for being at the table today, and thanks to all of you for listening and watching. At the Table with CAHSAH is available on Apple Podcasts, Spotify, YouTube, and through CAHSAH. Big thanks once again to Healthcare Synergy for supporting this podcast today. And we'll see you for part 2. We're going to continue this conversation with Scott Strong. Thank you, everybody. We'll see you next time.
Thank you, Mark.